A silent stroke, also known as a silent cerebral infarction, SCI, or silent brain infarction, is a type of stroke that doesn't present with the typical symptoms of a regular stroke. Unlike a full-blown stroke, which may cause sudden weakness, confusion, or difficulty in speaking, silent strokes are asymptomatic or exhibit very mild symptoms. This makes them particularly challenging to detect. Silent strokes are typically caused by a blockage in the blood vessels of the brain. This blockage limits blood flow to a certain area of the brain, leading to the death of brain tissue. However, because the symptoms are subtle or absent, they often go unnoticed by the individual who experiences them. Over time, these small strokes can accumulate and result in significant brain damage, leading to various cognitive and physical impairments. In this video, we will explore the world of silent strokes and discuss 8 silent stroke signs that you should never ignore. Number 1. Sudden memory loss. Memory is a fundamental aspect of our cognitive abilities. Sudden memory loss, particularly when it's not associated with aging or other known factors, can be a silent stroke sign. Memory-related issues often go unnoticed or are dismissed as common forgetfulness, but they should not be ignored, especially when they occur suddenly or worsen over time. Memory loss in silent strokes results from the damage caused to specific areas of the brain responsible for memory formation and retention. The brain cells affected by a silent stroke can no longer function properly, leading to difficulty storing and retrieving information. This symptom may manifest as forgetting recent events, names, or tasks, and it can have a profound impact on one's daily life. It's important to differentiate between normal, age-related forgetfulness and memory loss that may indicate a silent stroke. As we age, it's natural to experience some decline in memory and cognitive function. Misplacing your keys or forgetting a name from time to time is typical. However, when memory loss is sudden, severe, and significantly disrupts your daily routine, it could be a sign of an underlying issue, such as a silent stroke. Number 2. Vision problems. The eyes are often described as the windows to the soul, but they can also provide valuable insights into our overall health. Changes in vision, such as sudden blurred vision, double vision, or even partial blindness, can be indicative of silent strokes. The visual system is intricately linked to various parts of the brain, and when these areas are affected by a silent stroke, it can lead to visual disturbances. Understanding the connection between silent strokes and vision problems is essential. Silent strokes disrupt the normal flow of blood and oxygen to parts of the brain, including those responsible for processing visual information. This disruption can lead to a wide range of visual symptoms, making it vital to recognize vision changes as potential silent stroke signs. Vision problems should never be ignored or attributed to other causes without a thorough evaluation. The eyes are delicate, and vision changes can be a warning sign of underlying health issues, including silent strokes. Number 3. Severe headache. Headaches are common and can have various causes, from tension and sinus issues to migraines. When a headache is sudden, severe, and different from your typical headaches, it can be a sign of a silent stroke. Silent strokes can cause damage to the brain, resulting in headache symptoms that are more intense and persistent than usual. Recognizing a silent stroke-related headache can be challenging because it shares similarities with other types of headaches. However, there are distinguishing factors to consider. Silent stroke-related headaches often come on suddenly and may be more intense than previous headaches. These headaches may have unusual characteristics, such as a different location, quality, or duration compared to your typical headaches. Silent strokes can be accompanied by other neurological symptoms, such as weakness or speech difficulties, which can be a red flag that the headache is related to an underlying brain issue. Number 4. Difficulty swallowing. Swallowing is a complex process that involves the coordination of various muscles and nerves. When a silent stroke impacts the areas of the brain responsible for swallowing, it can lead to difficulty in swallowing, a condition known as dysphagia. Dysphagia can manifest as a sensation of food or liquids getting stuck in the throat, coughing or choking while eating or drinking, and an increased risk of aspiration pneumonia. It's a symptom that can significantly affect one's quality of life. Ignoring difficulty swallowing can have severe consequences. Dysphagia can lead to malnutrition, dehydration, and respiratory issues such as pneumonia due to the increased risk of inhaling food or liquids into the lungs. It's essential to address this symptom promptly and seek medical evaluation to determine its cause and appropriate management. Number 5. Weakness in the face or limbs. Weakness often occurs on one side of the body and can be temporary or persistent. It can affect the face, arm, or leg and may interfere with the ability to perform everyday tasks. While weakness may not be as dramatic in a silent stroke as in a regular stroke, it should not be underestimated. It's crucial to recognize these symptoms when they occur, as they can indicate ongoing damage to the brain that needs prompt attention. Furthermore, weakness can affect different parts of the body, and the specific location can provide valuable insights into the affected brain area. Common areas affected by weakness in the context of a silent stroke include drooping on one side of the face, weakness or difficulty in lifting or moving one arm, and difficulty walking or loss of strength in one leg. Number 6. Loss of coordination. Maintaining coordination, or the ability to move your body smoothly and in a controlled manner, is a critical aspect of daily life. When a silent stroke affects the brain regions responsible for coordination, it can result in a loss of coordination, which may manifest as clumsiness, unsteady movements, or difficulties with fine motor skills. Coordination issues can impact a person's ability to perform various tasks, from walking and dressing to writing and using utensils. These symptoms may develop gradually and are often overlooked until they significantly interfere with daily activities. Loss of coordination can have a profound impact on daily life. It can affect a person's independence and ability to engage in everyday activities. Simple tasks like walking, getting dressed, or preparing meals may become challenging, leading to frustration and reduced quality of life. Number 7. Trouble speaking. Our ability to speak clearly and coherently is a complex process that involves several regions of the brain. When a silent stroke affects these areas, it can result in trouble speaking or slurred speech. This is one of the more noticeable signs of a silent stroke and should never be underestimated. Difficulty in speaking can take various forms. It may manifest as difficulty finding the right words, slurring of speech, or even complete loss of the ability to communicate verbally. These symptoms are often sudden and can be alarming, as they may interfere with daily interactions and activities. Recognizing speech issues as a potential sign of a silent stroke is crucial because early intervention can significantly improve the chances of recovery. Unlike other signs that might be subtle or easily dismissed, trouble speaking or slurred speech is a clear indication that something is wrong with the brain's function. Number 8. Trouble with walking. Walking is a fundamental motor skill, and when it's affected by a silent stroke, it can lead to trouble with walking, such as an unsteady gait, balance problems, or difficulty lifting the feet. Walking difficulties can result from damage to the brain areas responsible for motor control and coordination. These symptoms may develop gradually, making it crucial to recognize them as potential signs of silent strokes. Trouble with walking can significantly impact an individual's mobility, making it challenging to move around independently. This can lead to a decreased quality of life and the risk of falls and injuries. We have now reached the end of the video. Thank you for watching. We hope you find this information valuable and useful. If you enjoyed this video and found it helpful, please don't forget to give it a thumbs up and hit that subscribe button so you never miss out on our latest health and wellness content. Thank you once again for joining us today, and we look forward to seeing you in our next video.